Thank you, Erica. Okay, I call this meeting to order. Welcome everyone to meeting number 27 of the House of Commons Standing Committee on Health. Pursuant to the order of reference of May 26, 2020, the committee is resuming its briefing on the Canadian response to the outbreak of the coronavirus. To ensure an orderly meeting, I would like to outline a few rules to follow. Interpretation in this video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen of either Floor, English, or French. As you are speaking, if you plan to alternate from one language to the other, you will need to also switch the interpretation channel so that it aligns with the language you are speaking. You may want to allow for a short pause when switching languages. Before speaking, please wait until I recognize you by name, or during questioning, the questioner will indicate to whom they want the question directed. When you are ready to speak, you can click on the microphone icon to activate your mic. A reminder that all comments by members and witnesses should be addressed through the chair, and when you are not speaking, your mic should be on mute. I would like now to welcome our first panel of witnesses. For the Correctional Service of Canada, we have Ms. Anne Kelly, Commissioner, Alain Toussignan, Senior Deputy Commissioner, Jennifer Wheatley, Assistant Commissioner, Health Services. And for the Parole Board of Canada, we have Sylvie Blanchet, Executive Vice President, and Daryl Cherney, Executive Director General. We'll now start witness statements. We'll start with the Correctional Service of Canada. You have 10 minutes, please.
Okay, good afternoon, Mr. Chair and members of the committee. We appreciate the opportunity to update you on the current status of COVID-19 cases in our institutions before continuing with an overview of the Correctional Service of Canada, or CSC's testing approach and plans moving forward. Mr. Chair, I'm very pleased to be able to report that thanks to the tireless efforts of staff and because of the exceptional measures taken, we only have one remaining active COVID-19 case among inmates across our 43 institutions. Since the pandemic began, we have had outbreaks in 5 of our 43 institutions, with 360 inmates testing positive out of a total of 13,900 inmates. 357, or 99%, have fully recovered. 1 inmate from the Federal Training Center in Quebec remains in hospital, but not in the intensive care unit. And we have had 2 deaths. Of the 5 outbreaks, 4 are fully resolved, meaning that 28 days have elapsed since the last positive case. Our last outbreak at the Federal Training Center in Quebec will be declared over tomorrow if there are no new cases. It is worth noting that we have had no outbreaks in the Atlantic and the Prairie regions, and the one in Ontario was limited to 8 inmates in 1 institution. Among CSC staff, out of 142 of our employees who have tested positive to date, 132, or 93%, have fully recovered. I want to take this opportunity to recognize the extraordinary efforts made by our employees for their ongoing work under these exceptional and challenging circumstances. From the outset of the pandemic, CSC took a proactive approach, guided by public health authorities and working closely with our union partners to ensure the health and safety of staff and offenders in all of our institutions. When the pandemic was declared on March 11th, we focused heavily on preventing the introduction of the virus in our institutions by quickly suspending visits from the public, temporary absences except when medically necessary, work releases, and interregional transfers. At the end of March, the virus was introduced into one of our facilities, and the goal became the prevention of its spread, and over time included measures such as strengthening infection and prevention control measures and cleaning and disinfecting protocols, actively screening all staff at the front entrance, moving to unit-based staffing to prevent staff rotation throughout the institution, training staff on donning and doffing PPE equipment, limiting the movement of inmates, conducting daily wellness checks for signs of symptomatic inmates, immediately testing for COVID-19 anyone reporting symptoms, medically isolating for 14 days inmates with symptoms or who had tested positive for the virus or who were being admitted to federal custody, working with local public health authorities to ensure inmates' access to local hospital care if required, issuing masks to staff, symptomatic, and positive inmates, and then to all inmates, implementing our own tracing capability by training over 200 of our employees, reconfiguring our Corcan shops to produce disposable and washable masks and gowns. CSC also worked with the Public Health Agency and local health departments and community experts to have independent, expert-led reviews completed in all of its facilities. To date, all 43 of CSC's institutions have had an infection prevention and control or an environmental health review completed. The reviews acknowledge that COVID-19 is difficult to contain in closed environments and recognize the strong frontline leadership and the commitment of CSC staff to prevent and contain the spread of the virus. There's also a reminder of the importance of training staff on donning and doffing PPE, having strong cleaning and disinfecting practices, and limiting the movement of staff and inmates to prevent spread. None of the findings are insurmountable, but they will require continued focus to be sustainable in the months to come. Work is currently underway to ensure CSC is well positioned moving forward. Now, I'd like to speak briefly about CSC's testing strategy. First, healthcare staff actively screen and monitor all inmates for COVID-19 symptoms. As previously mentioned, CSC medically isolates inmates who are newly admitted to CSC or returning to CSC as a result of a suspension or revocation of their release. Inmates who have symptoms or have tested positive and their close contacts until medically cleared. Inmates who are released to the community from an institution where there is an outbreak on the recommendation of local public health. With respect to staff, any employee who is symptomatic or has tested positive, as well as their close contacts, must self-isolate for a minimum of 10 days, including 2 consecutive days symptom-free. Currently, symptomatic inmates and staff get tested. Contact tracing is then completed and testing offered to those in close contact. Inmates and staff who are at risk of contracting COVID-19 when there is an outbreak also get tested. For any positive test, contact tracing is completed and testing offered. Moving forward, CSC will offer testing based on its recently expanded testing strategy. The strategy is responsive to CSC's closed environment, is well received by the unions, and exceeds most, if not all, provincial testing strategies. In addition to the testing currently completed, the expanded testing strategy includes testing of all inmates at time of admission or return to federal custody. This is in addition to the 14-day medical isolation that will continue. Testing of all inmates prior to their release to the community. Positive results will be reported to the local public health authorities and a plan jointly developed. Expanding the testing of staff and inmates in institutions located in areas where the rate of community transmission is elevated, which is called asymptomatic surveillance. For any positive tests, contact tracing will be completed and testing offered. The testing will be offered again over several weeks or months as long as the institutions remain in the communities with elevated transmission. There are currently 4 areas in the Quebec region that have high rates of community transmission, and there are 7 institutions located within those 4 areas. Testing has been offered to all staff working in the institutions in the Laval area. CSC currently has sufficient capacity to test all symptomatic inmates, which it is currently doing. However, the expanded testing capacity will be achieved through partnerships. CSC has already begun reaching out to health partners to increase its capacity through MOUs with public health authorities, as well as contracts with private labs. The strategy will be implemented in a phased approach over the next several weeks and months as MOUs and contracts are finalized. In order to prevent and contain the spread of COVID-19 in the months to come, especially as CSC starts easing some of the restrictions it imposed, the expanded testing strategy will be of critical importance. Although the institutions were never closed, measures were taken to prevent and contain the spread of the virus. Visits were suspended and programming was curtailed. To shape our new normal, I've put in place a governance structure made up of subject matter experts, union partners, and senior managers from different sectors of CSC, including regional representatives. External stakeholders are also involved, including our Citizens Advisory Committee chair and non-governmental organizations. This approach allows us to examine what needs to resume and when, and the safeguards that need to be put in place. Our approach will be gradual, likely vary across different regions, and take into account public health advice. As a first step, we will be looking at reinstating small group programming for inmates at some institutions, as this is key to their successful rehabilitation and to public safety. In conclusion, as I say often, there is no greater responsibility than having the care and custody of other human beings. As Commissioner, I appreciate the work of our staff, partners, stakeholders, and volunteers for their amazing efforts during these extraordinary times. Thank you, Mr. Chair and members of the committee, and I'll be happy to respond to any questions you may have.
Thank you. We will go now to the Parole Board of Canada. You have 10 minutes. Please go ahead.
Thank you, Mr. Chair and members of the committee. With me today is the board's Executive Director General, Daryl Cherney. We are pleased to appear before this committee as part of its study into Canada's response to the COVID-19 pandemic. I will use my opening statement to outline the various measures taken by the Parole Board of Canada since the outset of COVID-19 to ensure the continuity of its operations and the delivery of its important public safety mandate. However, before I do so, I would like to provide committee members with some information about the PBC's mandate, as the board has not previously appeared before this committee. The PBC is an independent administrative tribunal which reports to Parliament through the Minister of Public Safety and Emergency Preparedness. We are part of the public safety portfolio, which also includes the Correctional Service of Canada. The board has the authority under the Corrections and Conditional Release Act, or CCRA, to make conditional release decisions for federal offenders.
Point d'ordre, Monsieur le Président.
One moment, please, Mr. Chairman. Point of order. Is there any chance of having the speakers slow down somewhat? It's very interesting and it is going very quickly. Thank you. Thank you, Mr. Desilets.
Could actually slow down a tad, that would be helpful. Thank you.
I will, thank you. To make conditional release decisions for federal offenders serving sentences of 2 years or more. Some authorities in law for the release of offenders are the responsibility of the Correctional Service of Canada. The Parole Board also makes parole decisions for provincial and territorial offenders serving sentences of less than 2 years in all provinces and territories except Ontario and Quebec, which have their own parole boards. PBC also has legislative responsibility to make decisions on record suspension under the Criminal Records Act and the Criminal Code of Canada, order or refuse to order the expungement of a conviction under the expungement of historically unjust.
Excusez-moi.
Point of order, my apologies. Point of order. The sound from the interpretation channel is very bad, and that needs to be corrected because we really don't understand very well. I'm very sorry.
Yes, Madam Clerk, could we do, is this a problem we can address right now, or do we need to suspend?
Thank you, Mr. Chair. It should be fine to go now.
Okay, we'll try again, and Monsieur Desilets, please don't hesitate to let us know if it's not working. Go ahead, Madame Blanchet.
Thank you. Make recommendations for the exercise of clemency through the royal prerogative of mercy. The PBC consists of both GIC appointed board members as well as public service employees that support them in their decision-making role in the fields of criminology, law, corrections, education, psychology, social work, and the private sector, to name but a few. Our conditional release program represents the majority of our work. In 2019-2020, the Parole Board conducted 15,174 conditional release reviews. On a weekly basis, the PBC conducts an average of 281 federal reviews and renders a total of 407 federal decisions. These include reviews and decisions for temporary absences, day and full parole, post-suspension, detention, and the varying of conditions for release. In making conditional release decisions, the law requires the Parole Board to take into consideration all relevant available information related to an offender's case. Board members must consider and weigh information such as court and sentencing information, the nature and gravity of the offense, and information obtained from victims, the offender, and other components of the criminal justice system, including assessments provided by correctional authorities. No single factor in a conditional release review is ever determinative in the PBC's decision-making. Public safety is the paramount consideration in all decisions and must be balanced against a rigorous risk assessment of the offender's ability to safely reintegrate into the community. The board does not prepare offenders for release, nor does it manage or supervise offenders on release. That is the responsibility of the Correctional Service of Canada. The Parole Board's conditional release outcomes reflects the high quality of its decisions. Last year, 99% of day parole supervision periods and 98% of full parole supervision periods were not revoked for reoffending, and these numbers have remained consistent over the past 10 years. I will turn my attention now to the board's operations and the measures we've taken during the COVID-19 pandemic. Since the outset of COVID-19, the PBC has taken measures to protect the health and safety of the public, the offenders, its board members, and staff, while continuing to deliver its important public safety mandate. In doing so, we have been informed and guided throughout by the advice and recommendations of public health officials. During this unprecedented period, PBC has streamlined its operation to focus on core functions in the areas of conditional release decisions, operations and appeals, pardons and record suspension, board member appointments, and essential internal services. These core functions are primarily being delivered by board members and staff working remotely, and by a small number of board members, executive, managers, and critical staff working in PBC offices while practicing social distancing. Parole hearings are being conducted remotely via video conference or teleconference as applicable outside of correctional institutions. The PBC has also worked to streamline its processes and has modified some of its policies to provide additional flexibility to CSC and community.
Point of order,
health.
Mr. Chair, do you hear me? I've got no volume coming through for the last 2 minutes, and I'm checking everything here. I don't know if anyone can hear me, but I can't hear a thing. I've lost complete sound. So perhaps it's just on my end. I'll just fiddle with a few things here, but I lost the last thing that this wonderful witness just said the last 2 minutes.
Ms. Fisher, do you need to suspend so you can get that sorted out? Mr. Fisher, can you hear anything? I think we'll suspend for a few minutes and get this sorted out. Meeting is now suspended. Okay, the meeting is now resumed. Ms. Blanchet, you may continue with your statement. If you'd like to back up a couple minutes, because Mr. Fisher wasn't able to hear it all, that would be acceptable.
Sure. Thank you very much. Parole hearings are being conducted remotely via video conference or teleconference as applicable outside correctional institutions. The PBC has also worked to streamline its processes and has modified some of its policies to provide additional flexibility to CSC and community partners. For example, offenders already in the community on day parole and who become eligible for full parole, the PBC has implemented efficiencies to expedite those decisions by proceeding by way of paper review. The PBC has also amended its policy to allow the Correctional Service of Canada to authorize emergency medical leave privileges for offenders residing in the community for up to 30 days rather than the current 15-day limit. The PBC also continues to process parole by exception cases as expeditiously as possible. Parole by exception is a mechanism in law to permit parole consideration for offenders who have not yet reached their parole eligibility date in exceptional circumstances, including for offenders who are terminally ill or whose physical or mental health is likely to suffer damage if the offender continues to be held in confinement. Since March 1st, 2020, 7 parole by exception cases have been granted. There are currently 33 pending decisions. In comparison, only 4 parole by exception cases were granted in all of last year. The PBC is also working with CSC to better accommodate the circumstances of offenders during the pandemic, such as imposing a condition to reside at a home or family environment where such placement is risk appropriate, rather than in a community-based residential facility. Since March 1st, we have been making an average of 11 day parole to other location decisions per week, compared to 5 per week in 2019-2020. Further, the PBC has worked closely with CSC to review cases where offenders residing in community-based residential facilities may have had their residency condition change to specify another location, such as a family home. Since March 1st, 2020, we have been averaging 7 such decisions per week, compared to an average of 1 decision per week last year. Given the current restrictions due to COVID-19, the deadline for an offender to submit an appeal to the Appeal Division has been extended from 2 months to 3 months in order to assist the offenders in preparing their appeal, especially if they need to seek the support of outside resources. In accordance with the CCRA, offenders have the right to an assistant at their hearing, and we have been able to facilitate participation of offender assistants remotely by teleconference. The PBC remains committed to ensuring victims' voices are heard during the unprecedented situation, and they continue to receive all legislated information for which they are entitled to. PBC has implemented technological and procedural enhancements in order to provide victims, as an interim measure, the ability to participate at PBC hearings via telephone and have their victim statement considered by board members. Because our hearings are being held remotely, this means that a typical hearing can have 6 or more individuals from different locations connected. For victims who prefer not to attend a hearing, the PBC continues to accept victim statements in various formats, including audio and video recording. In these unprecedented times, Mr. Chair and members of the committee, the PBC has taken measures to ensure that it continues to deliver its important safety mandate under extraordinary circumstances. I am extremely proud of the resilience and commitment demonstrated by our board members and staff in the face of these challenges. On a final note, I would also like to invite committee members interested in attending a parole hearing once we are back to conducting in-person hearings to get in touch with us, and we would be happy to facilitate this. Thank you.
Thank you, Ms. Blanchet. So we will start our questioning. I should mention something I forgot to mention off the top is this meeting will have a hard cap at 3 o'clock Eastern time because the facilities are required for another meeting. So we will start the questioning. We will do 2 rounds of questions with this panel. We'll start the questions with Monsieur Paulus. Monsieur Paulus, allez-y, 6 minutes, s'il vous plaît.
Merci, Monsieur le Président.
Thank you very much, Mr. Chair. Now, you remember Marlène Lévesque. I imagine Ms. Kelly, Ms. Blanchette, you'll recall that there was an investigation called by the government, an internal investigation. Where are we up to there, and what's been done since March regarding this investigation?
Madame Kelly.
Okay.
Quelqu'un m'entend?
Can you hear me there?
Okay.
I'll respond in French. Now, because of COVID-19, we suspended the investigation for the time being because those involved had to travel, and of course that was not possible during COVID-19. Now, work will resume, and work has been ongoing, but there were interviews that were supposed to take place that required people travelling, and that's been suspended for the time being. Question: well, can you give me a rundown of what's been done thus far? How many meetings have been held? When you say suspended, you mean that everything just stopped completely? When did you actually suspend? Response: well, we suspended probably mid-March when COVID-19 was declared a national health emergency. And then I can tell you more about where we're up to, if you like. Question: well, we're holding a committee meeting, and we can hold meetings. So I imagine that in your service, you can hold virtual meetings over Zoom, as we are right now. Why isn't that possible, for example? Question or response: I'll ask Mr. Tousignan to answer that question. Mr. Tousignan? Says Mr. Paulus. Mr. Tousignan? Yes, thank you, sir. I'll also respond in French. Well, I think it's, a completely different kettle of fish holding this kind of committee and running an investigation and speaking to employees, asking for their versions of the facts in situations which were highly traumatic for them, and also that have a great gravitas. So it's difficult to compare apples and oranges in that sense. That said, in some cases, it will be possible to make summaries and to carry out some interviews over the telephone and by video conferencing. However, some interviews will have to take place in person to properly conduct the investigation, and so it comes to its natural endpoint. Thank you, Mr. Tousignan. And for the benefit of the committee, I'd like an update, a written update of what has been done in the course of your investigation. Obviously, we can't have confidential information disclosed, but at least an overview of what has been done to date, which will be extremely important, not only for us, but for the family of Madame Lévesque. Ms. Blanchette, you reported earlier on the different types of paroles or conditional releases that have been carried out to date. Now, for our part, we have seen that Minister Blair has called for on a fast-tracking of paroles or conditional releases for detainees who had medical problems or who are more elderly or whose terms or sentences were coming to an end. But there are some offenders that have a dangerous profile, and releasing them into the community in the middle of the COVID-19 crisis with limited facilities and services is not advisable. Could you tell us whether the current cases of parole are for those who were suffering illness or were reaching the end of their lives, or as some cases may have fallen through the cracks? Response: I don't know if you can hear me clearly. Yes, I can hear you clearly, says Mr. Paul Hu. Well, at the board, the risk assessment does not change whether or not there's COVID-19 or not. We have to take into consideration all information brought before us, and that is what's occurring. I can't think of the word in French, but parole by exception for those who are not eligible. Perhaps you're referring to that, but the Act hasn't changed, the legislation hasn't changed. Our commissioners have to carry out the same risk assessment. The minister has asked for a fast tracking, but not of the procedures that we carry out. We're working all together to ensure that any parole or conditional release is in line with the legislation. So, in other words, it's based on the statutes and a risk investment, and because the legislation hasn't changed. Question: could you please explain? Well, there's a case in Chicoutimi.
Pardon me, I'm sorry. Madame Blanchette, could you hold the mic in front of your mouth when you respond, please? Sorry, go ahead, Monsieur Paulus.
Merci, Monsieur le Président.
Thank you, Mr. Chairman. I'll come back to a parole case a few weeks ago. Denis Bouchard was freed a few weeks ago, and the victim hadn't been notified. So you do have processes to get in touch with the victims, but it wasn't done. Can you please confirm that all victims are confirmed so that they can attend the hearing before anyone is released? What I can confirm is that victims who registered with the Commission in order to receive information do. There are victims who are not aware that they have the right to access the parole board's information. In our case, when victims are registered with the board, then we have processes to inform them. And they can tell us if they have any concerns about the inmates being released. But not everyone registers with the parole board. Thank you. Mr. Chairman, I think I'm coming to the end of my time, but I'd like to seize this opportunity to table the two motions that have been submitted to the committee. Can I do that now?
It depends on the motions. The motions for which we received a notices of motion can be moved now.
Oui, merci, Monsieur le Président. Oui, c'est deux motions qui ont été déposées.
Thank you, Mr. Chairman. Yes, these two motions were tabled with the clerk a few weeks ago, so the Commission does have them. I can read them for the committee, or we can ask the clerk to do it. It's entirely up to you, Mr. Chairman. I'm listening.
Please move them. It's probably best to read them.
Okay.
And do them one at a time, please.
Parfait. Donc, première motion.
The first motion, that in accordance with Standing Order 108A, the committee send for the following documents, information notes, memos, and emails prepared for the Deputy Minister of Public Safety and the Minister of Public Safety regarding the closure of the Canada-US border, which came into force March 21st, 2001, and all documents pertaining to the extension of that closure, and that all such documents be provided by August. That Public Safety Canada provide all information on services infected by COVID-19 between March 11th and August June 15th, 2020, and that these statistics be presented to the committee no later than July 10th, 2020.
So I would ask the members if anyone wishes to speak to this to use the raise hand function. If you look on the participants panel, the participants button, there's a raise hand button on the lower hand, and I will try to deal with interventions as they. So I believe I saw Mr. Thériault has put up his hand. So go ahead, Mr. Thériault.
Bon, j'ai fini par arriver.
I finally managed to take myself off mute with regard to these two motions, which are identified, if I'm not wrong, as notices of motion in the name of Mr. Kitchen. As for the second one, that seems fine to me. We would like to take out the reference to emails so that the motion on border closures be more realistic with regard to the information on record, since emails may or may not be relevant, and we might end up being completely buried under information. So I would like to amend the motion to remove and emails. That's in the first motion.
Just one moment. We'll deal with one motion at a time. Sorry, whose point of order was that?
It was mine, but I think you're getting to that, which is, can we do one at a time? Because otherwise I'm confused as to which one's the first and the second. So can we just do them one at a time?
Right. There is one motion on the floor at this time. That's the one to which we are debating and so forth. So we now have an amendment put forward by Mr. Thériault. The debate will be now on the amendment. So Mr. Thériault has moved to amend the original motion by dropping the words "and emails." And is there any discussion on this? I see Mr. Fisher has his hand up.
Thank you, Mr. Chair, and thank you, Mr. Thériault, for that suggestion, which I fully agree with and will support. Mr. Chair, sorry to be seeking clarity here, but Mr. Paulus moved two motions. Are we only dealing with the first motion that he put forward in the name of Mr. Kitchen on the closure of the Canada-United States border? Is that the only motion we're dealing with at this point? And then we will pass or not pass that particular motion. And then today, we will deal with the second motion as well while our witnesses are here? Just getting some clarity.
Yeah, well, Mr. Paulus had mentioned both motions. He only moved one. He moved the one regarding the border closures. And so we will be dealing with the motions when moved one at a time.
Monsieur Président.
Mr. Chairman, I read two motions. In fact, I did read two motions. The first was on the closure of the Canada-US border, and the second is on the health of staff working with the RCMP, CBSA, and correctional officers.
Motions, but we can only deal with one at a time. So I believe that you actually moved the one on border closures. So we are dealing with that motion, and there is an amendment on that motion made by Mr. Thériault to drop the words "and emails" from the text. And on that amendment, we now, Mr. Fisher, your hand is still up.
Yeah.
Go
So
ahead.
again, just seeking clarity in this, that we have one motion on the floor and there's now an amendment, and that is what we are speaking to, not to the motion, only to the amendment of whether we support it, or the debate will be only on the amendment of Mr. Theriault, correct?
That is correct.
So if we have other amendments that we would like to make, we would make them after Mr. Theriault's amendment?
That is correct. Once we vote on Mr. Theriault's amendment, whether whichever way that vote goes, that will be the new motion, and then we can amend it further if desired.
Thank you, Mr. Chair. Then I'm good. I'm happy to come back with potential further amendments.
Thank you, Mr. Fisher. We go now to Monsieur General.
Thank you, Mr. Chair. I think the confusion was when Mr. Paul Hoos asked you if he should move both motions or one motion, and you said two motions. I think that's
correction.
that,
I said move one motion, so we can only deal with one motion at a time.
I think I'll argue with you, Mr. Chair. I think we go back to the blues, and I think you're wrong. However, that wasn't my my intervention. Intervention is based on Mr. Theriault's amendment. Not sure what if this is him simply looking for less work to do or what, but requesting the removal of emails, I think, is pertinent to essentially what we're trying to get at. There's certainly a lot of back and forth over email. This was remember, this was the same member that brought up the removing of text messages as well. And both times, this is certainly something that would argue is important for us at the committee level to understand. We're looking at the overall response of this thing. If Mr. Theriault doesn't want to read a whole bunch of emails, then he simply doesn't have to read those emails. We'll do that work for him. So certainly don't support his amendment.
Point d'ordre, Monsieur le Président. Point d'ordre, Monsieur le Président.
Point of order, Mr. Chairman. Point of order. Mr. Chairman, the Conservatives have already tried to besmirch my reputation, so I cannot accept that this be done in front of witnesses who are waiting for us to hear them. I cannot accept that he's saying I'm moving an amendment because I don't want to do any work. I would ask Mr. Généreux to withdraw that comment immediately. It is a disgraceful thing to say, a lack of respect towards colleagues. I have said exactly why I wanted to eliminate the mention to emails. Mr. Fisher said he agreed. I imagined that, what does that mean? Mr. Fisher doesn't want to work either. I spoke about the fact that these would be associated with a series of motions that had already been tabled, and we needed to be able to do the work and to actually go through the information we receive. I have already had experience with access to information requests where we were buried in piles of documents that were completely irrelevant. So I don't see why texts for an initial draft that was eliminated months ago are actually relevant. We can certainly judge this on debate, but I would ask Mr. Généreux to act respectfully towards his colleagues. I work very hard, and I am known to do that, so I would ask him to take those comments back, because his attempt to once again sully my reputation is disgraceful. The Conservatives acted disgracefully last time and did not even apologize when they themselves moved exactly the same thing 3 weeks later. So can we please have a calm debate on substance and not hypothesize about the intentions of people moving amendments? Mr. Chairman, I would ask you to manage this properly, because I will not accept this.
Is there any comments or response on Mr. Theriault's point of order?
Yes, Mr. Chair. Len Weber.
Go ahead, Mr. Weber.
Mr. Chair, Mr. Theriault is referring to Conservatives talking poorly about him. I have not once made any comment on Mr. Theriault in a disrespectful manner, so I would ask that Mr. Theriault please retract those statements referring to conservatives. I am a conservative and a proud one, and I have not once said anything poorly against Mr. Theriault. Thank you.
Any other comments on Mr.
Monsieur le
Theriault's
Président,
Go ahead.
Mr. Chairman, I would invite Mr. Weber to read Mr. Bellavance's column in the press and to hear what colleagues Mr. Paulus and Mr. Arès has to say, and then he will see that what I'm saying is absolutely true. So could we please stick to rational debate, please?
Is that?
Mr. Chairman, je n'aurais pas dû laisser ceci devenir un débat. C'est en fait un rappel au règlement et ce n'est pas assujetti au débat. Si M. Généraux veut présenter ses excuses, ce sera à lui de le faire. Sinon, nous allons continuer. Monsieur le Président.
Mr. Theriault's.
Point of order.
Point of order.
We have a point of order already on the floor.
We're getting French. We're getting French translation over the English. So I am anyhow. I don't know if you are. So we can't understand any. Well, I'm doing two languages at the same time.
Okay, so Mr. General, please make sure that your language is on English if you're speaking English. And we'll try again. Go ahead, Mr. General. Did you want to respond quickly to Mr. Theriault? And let's not get into debate.
Okay, thank you, Mr. Chair. Yeah, to address Mr. Theriault's point, I'm unaware of what article he's referring to. I'd ask him to table that at either this meeting or a future meeting, and we'd be happy to look at more detail of what that means. And then certainly happy to address anything any issues he has with me.
Okay. Okay, so we will. We'll leave this to be resolved between the members. I would urge everyone to remember that to proper decorum and to be respectful of each other. And we will resume debate on the amendment proposed by Mr. Theriault. I have on my list now, I have Dr. Jaczek. Dr. Jaczek, please go ahead.
Well, thank you, Chair. And certainly I echo your comments in terms of respecting each other. And through the very many meetings that I've attended of the Health Committee, I think we have had a very respectful dialogue between us. And I certainly would hope that continues. In speaking to the amendment proposed by Monsieur Theriault, I would certainly agree that removing the reference to emails is a good one. The kind of quantity that could be generated by including emails, and I really don't see, that would be a huge amount, of course, but I really don't see how that would add to obviously what we all want to see, which are the briefing notes, the background documents, and memos that relate to the closing of the United States-Canada border. So I think as it would read with the amendment, though I'm wondering again about the timing of this, but certainly we would have enough information and I'll be supporting Monsieur Theriault's amendment. Thank you.
Thank you, Dr. Jaczek. We have on my list now, I have Mr. Kellaway. Mr. Kellaway, go ahead.
Thanks, Mr. Chair, and to the witnesses, my personal apologies for the delay here, but this is democracy at work, and sometimes it gets a little messy. I would support the amendment that Mr. Theriault has put forward. It's logical, and as Dr. Jessica said, it is one that to me is based on a common sense, at least from my perspective. And my understanding as well, Mr. Fisher mentioned, and I think this is accurate, once again, that we're voting on this this amendment, and I have a couple of other items with respect to an additional amendment, and that'll be forthcoming. Thank you.
Thank you, Mr. Killaway. We go now to Ms. Sidhu. Ms. Sidhu, go ahead.
Thank you, Mr. Chair. I just want to echo with my colleagues. I support Mr. Theriault's amendment, and we should be respectful with each other. Thank you.
Thank you, Ms. Sidhu. We go now to Mr. Fisher. Mr. Fisher, go ahead.
Thank you, Mr. Chair. I guess I still had my hand raised from before, but I do want to say that since this committee has been formed, Mr. Theriault has been incredibly professional, very, very prepared, and is known in the House as one of the hardest working members of Parliament. So I do want to make sure that that's on the record, Mr. Chair.
Thank you, Mr. Fisher. Let's try and keep our comments on the amendment. We go now to Dr. Pawlowski. Dr. Pawlowski, go ahead, please.
I wanted to further support the amendment. My thinking is that, and now I got to preface my remarks by saying that my riding extends all the way from Thunder Bay, so Lake Superior, to the Manitoba border. So I have the total border. And I can say that there's been no issue which comes up more frequently than border issues. People who have a business across the border want to go across the border. People who have family members who are across the border. People call my office and say they saw a license plate from someone from Minnesota towing a boat, and they think they're coming up here as tourists. And aren't we supposed to just be allowing essential people to come into Canada? So there's this non-stop questioning about what's happening at our borders. And I would think similarly, the people working in Border Services Canada face the same number of questions every day. So these are people who evidently have a lot to do and a lot of issues coming up before them, and to ask them to, rather than address these very real issues, to take a lot of time going over every email would seem like diverting their attentions from where they ought to be at this time. So I fully support the
Thank you, Dr. Pawlowski. We go now to Mr. Paulus. Paulus, go ahead, please.
Merci, Monsieur le Président.
Thank you very much, Mr. Chair. As far as the debate between Mr. Généraux and Mr. Theriault is concerned, I'm not going to get involved in that. I want to make sure that the motion that I'm moving on behalf of Mr. Kitchen, the upshot is to shed as much light on the closure of the border, the reopening of the border, why it's taking so long to reopen the border, and there's underpinning all of this are the whole public health issues. Now, I understand, you know, the member from the BQ is asking for relevant information to be taken out of the equation. And in the Bloc Québécois, we believe that we need to hold the Liberal government to account and get as much information as possible. Yes, the Liberals have supported amendments to reduce the amount of information available to committee members and therefore by extension to opposition parties, and that's regrettable. So I would call on Mr. Theriault to remove his amendment to the amendment. I think that even the Bloc Québécois needs as much information as possible to make enlightened decisions.
Thank you, Mr. Paulus. Monsieur Theriault cannot remove his amendment. It would require unanimous consent to do that. We are debating the amendment, and it will be voted on one way or the other in due course. We go now to Mr. Van Bynen. Mr. Van Bynen, please go ahead.
Thank you, Mr. Chair. I'll be supporting this amendment. Sorry?
Mr. Paulus?
I think we have translation on the wrong channel here. Go ahead, Mr. Van Bynen.
Yeah, I'm on the English channel. And I, as I was saying earlier, I support the amendment as well. And I can give you a very classic example. In the last week, in one day, I received as many as 91 emails. It took me most of the day to get those 91 emails down to 21. And so if we start to look at an issue as broadly as this issue, I simply can't imagine the number of emails that will be clouding the issue. I think we need to maintain our focus on information that is relevant and not necessarily dilute the value of the information by overloading it with other information, which can all be gathered and can be sifted through in the documentation that this motion requests. One minor change is that if we're going to be deleting the "and" emails, we should add the word "and" in front of the word "motions." And I don't know whether or not that needs another motion. I'm not as familiar with parliamentary process as many of us, but I think that would have to be a consideration as well. So I would leave that to you, Mr. Chair, to decide on that. But I do want to say that what's being proposed here to eliminate the emails is a very legitimate request. And I think it's putting an unfair and a heavy burden of reporting for people who should be focusing on doing the right things during this current emergency. We have a pandemic in front of us, ladies and gentlemen, and in doing so, we should not be overloading the system. We should respect the time and the energy for all the people that are working on this, and I think removing the emails is a significant step in doing so. Thank you, Mr. Chair.
Thank you, Mr. Van Bynen. We go now to Mr. Weber. Mr. Weber, please go ahead.
Well, thank you, Mr. Chairman. Of course, I do not support this amendment to this motion. I'm not going to reiterate what my colleagues on the Conservative side have said. Mr. Paul Hoos said it quite eloquently. We need to get as much information as possible, and withholding information to me is just it just doesn't make sense. So eliminating emails is not what we should be doing. Mr. Van Bynen, all due respect, you sifting through emails and only pulling out information that is relevant. I don't understand who you think should be doing that then. Who should be sifting through these emails?
Remind everyone to speak through the chair. And
yes, Mr. Chair. I'm referring to what Mr. Bynen had indicated. The fact that these emails should be sifted, information that is relevant should be only distributed to us, but who makes the decision what is relevant and what is not? Thank you.
Thank you, Mr. Weber. We go now to Ms. Jansen. Ms. Jansen, please go ahead.
Yes, thank you. I know that all of us here at this committee are very much in solidarity in regards to transparency and openness. I think the whole point of this committee is to ensure we understand exactly what went on. And the idea of removing emails because it's too much work would there kind of stand in the way of that ultimate goal that we all have, which is ensure that we have complete openness and transparency on what has happened here. I live right by the border. These things are extremely important to all of the constituents in my riding. And I think it's imperative that we show that we truly are dedicated to transparency and openness and ensure those emails are available.
Thank you, Ms. Jansen. We go now to Mr. Davies. Mr. Davies, go ahead.
Thank you. Well, I think there's been some points made on both sides of this. I have noticed a pattern where, generally opposition wants more disclosure and government seeks to limit disclosure. And I see that pattern is repeating itself here today. I'm going to support the amendment only because if the disclosure of information that we get is not sufficient, I think it's open to Mr. Kitchen or Mr. Paul Hoos to move another motion requesting the emails. I don't find it persuasive to, and this is the second or third time I've heard the government side argue that it's too onerous to provide emails. Disclosure and accountability are foundational concepts. And I believe Mr. Trudeau has famously said that his government should be transparent by default, is what he told the Canadian public. So just because it's difficult or just because it's onerous to get emails, that's not a sufficient reason not to be, I think, to override the need for transparency. I also think in emails, I think what's behind the my conservative colleagues' motion is that there's a degree of frankness and granularity and detail that usually are found in emails that are not found in other documents. So I'm not going, by supporting this motion to move this meeting forward, that no way doesn't mean that I don't think that the emails aren't a valid source of information, and we could be pursuing those later on. I do want to comment on and ask the clerk to comment on redaction. When we passed a motion, when this committee passed a motion before for disclosure from the government, in my opinion, we had illegitimate, and frankly, I thought unjustifiable redactions by the government. And I want to make sure that we get the documents that are being sought here, we come in unredacted form, and that it's the clerk of this committee who will determine if anything is ought to be redacted or not. Last time, I think the privileges and of these committee members of us was violated when we received documents that someone else prior to sending them to us had redacted for all sorts of reasons, many of which were way beyond the grounds that are normally given for redaction. So if we're going to hold the government to account, and I think it's a good motion on behalf of my colleague to do so, particularly when the border is affecting so many Canadians in so many ways, both on an economic and a personal level, then I want this committee to get the unvarnished information that we seek. And so I want to be very clear on that. I'll be looking for documents that are not sanitized to protect the government's political interests like they were last time. Finally, I just want to say I don't find emails to be that difficult to get. There's search functions that exist in our computers that if a particular individual were asked to provide all emails that bore on the subject of border controls, I would point out to Mr. Van Bynen that it's a simple matter to use search functions to produce those documents. In fact, because emails are by definition stored on computers, it's actually very quick and easy to produce documents by email. So that is not an argument that I find persuasive. But to move this forward, I think we should have the vote on this. I'll support Mr. Thériault's motion to remove emails at this point on the proviso that we reserve the right to pursue those emails later on if we find that the documents that are produced to the committee are not sufficient for the purposes of my Conservative colleagues. Thank you.
Thank you, Mr. Davies. We go now to Monsieur Thériault.
Oui.
Go ahead.
Monsieur le Président, je suis d'accord avec les propos de mon collègue Davies.
Mr. Chairman, I'm very much in agreement with what my colleague Mr. Davies said. The motion is important. The committee is asking for all documents, and we do want relevant documents, particularly memos, reference documents, and background documents, briefing notes. If that is not enough to help us understand what led to the closure of the border, that would mean there is a serious problem somewhere, and then we can ask our questions accordingly. But I would point out, and hence my comment, that bad legislation is often legislation that can't be applied. The same party wanted to have all text messages last time. If we look at all the motions that have been tabled, because they're an entire series, and if each time we want to have all the emails from all the people who were involved, then I think that would be a lot. I think we should be focusing on relevant information, and I think the motion without emails would provide everything needed so that we can have a very clear idea of what's happened. And if we don't get a clear idea of what's happened, then we'll come back and ask for more. regarding Mr. Weber's question. The date is April 23rd, 2020. I would refer him to the article that appeared in La Presse on April 23rd, 2020. Thank you, Mr. Chairman.
Terrio, we go now to Dr. Pawlowski. Go ahead, Dr. Pawlowski. Dr. Pawlowski, your hand is up.
Well, I want to say, because there's been the issue of transparency is come up, and I think in asking to not include emails, I don't think the issue is one of transparency, because I think I certainly agree. We're talking about our relations with the United States, a totally different country. And when we're talking about the reasons for reopening the border, we're going to have to, I think, discuss what the United States is doing with respect to control of the disease. There's 50 different states in the United States. There's the federal government. They're all potentially doing different things with respect to COVID-19. So when people start talking about when to open the border, when not to open the border, of course, they're going to have to reference what is being done in the United States. And I don't know whether we want, as a government, to make public everything everybody said in discussing what the United States is doing in managing the outbreak, because certainly our relations with the United States are exceedingly important. The United States is our best friend. It's obviously our major trading partner, and we have to be very sensitive, I think, to our relationships with them. And I think what would be required would be then to open these all up to the public, and I'm not sure whether that's something that's really in our best interest as a nation.
Thank you, Dr. Pawlowski. Mr. Paulhuis, you're up. Please go ahead.
Merci, Monsieur le Président. Je crois qu'on peut procéder. On a débattu pour le bien des registres officiels.
Thank you, Mr. Chairman. I think we've debated.
D'aider le gouvernement à travailler moins. Mais bon, puis je sens une espèce d'antipathie entre M. Thériault et le Parti conservateur. Je trouve que c'est totalement inapproprié dans les circonstances.
I do see that Mr. Thériault is not very keen on the Conservative Party, but I think we should just go to the vote. Mr. Speaker, I would like to speak. Mr. Chairman, I had asked to speak.
Participants panel.
C'est pas grave. Mais oui.
Go ahead now.
J'avais levé. Moi.
I had raised my hand. I agree with Mr. Paulhuis. We should move to the vote. I think everything has been said. I fully agree with Mr. Thériault's amendment, and I support it. I would like to apologize to our witnesses for this rather cheap set of comments from Mr. Généraux, and we would like an apology for them.
Thank you, Mr. Desley. I see now Mr. Van Bynen. Go ahead.
Thank you, Mr. Chair. I just wanted to clarify with some earlier comments made by some of my colleagues. Yes, I understand how email works. Yes, I know how to sort your email and how to sort subject lines, etc. But my concern is around the scope and the scale of these types of discussions and the volumes that will be added to the review. And when I take a look at the date lines that are imposed on this motion, I think it's virtually impossible to thoroughly go through all of that information. And I genuinely believe that the other documents that have not been taken out of the motion would be sufficient to come to a conclusion. I fully support transparency, and I think it can be achieved with the documents that are being requested. Thank you.
Thank you, Mr. Van Bynen. Seeing no more interventions.
Yes, one more point of order, Mr. McKinnon.
Is it a point of order or
it was a point of order from a comment earlier on Mr. The Mr. Desailly from Quebec. You talk about Mr. Genereux making, as you say, cheap comments. I think that requires an extraction as well and an apology there too. If you're asking for apologies, so Mr. Chair, I just we are bickering here and it is ridiculous. Let's just move on with the vote. But making comments like that is just inappropriate. So just if you're going to criticize others, just think about what you say as well through the chair. Thank you.
Thank you, Mr. Weber. Once again, I remind everyone to be aware of and to be duly recognizing of correct protocol and courtesy. Seeing no further interventions, I will ask the clerk to conduct a vote on the amendment. Please go ahead, Madam Clerk.
Thank you, Mr. Chair. As mentioned, the vote is on the amendment of Monsieur Thériault. If you are in favor, please say yay. If you are opposed, please say nay. Mr. Fisher. Mr. Fisher, you are on mute. I need to hear you, please.
Thank you. Yay.
Thank you. Mr. Kellaway.
Yay.
Mr. Pulowski.
Yes.
Thank you. Ms. Sidhu.
Yay.
Mr. Van Bynen.
Yay.
Ms. Jansen.
Nay.
Thank you. Mr. Genereux.
No.
Monsieur Paulus.
No.
Mr. Weber.
No.
Monsieur Thériault.
Oui.
Mr. Davies.
Yes.
Mr. Chair, the results are 4 against and 7 in favor.
Thank you, Madam Clerk. So we now continue our debate on the motion as amended. Is there any debate or comment on this on the motion as amended? I see Mr. Kellaway. Mr. Kellaway, please go ahead.
Thanks, Mr. Chair. I'm not sure if it's the right time, but speaking of timing, can I speak to the timeline of August 10th, or would that be in something separate?
Yes, it is in order at this point.
Can I make a point of order?
Go ahead, Dr. Plow.
There was already the suggestion by Mr. Van Bynen that there was a need for an and in there before if we're going to amend it further. Are we going to deal with this issue next?
The amendment has already passed as moved by Mr. Thériault. If you require further amendments, we'll have to move further amendments. I believe Mr. Kellaway was in the process of you were asking a question, Mr. Kellaway. If you wish to talk about the timeline, it would be appropriate to do so now.
Okay, wonderful. In terms of the documents being submitted by August 10th, and given the many of the points that have been made this afternoon in terms of timelines and volume and girth of documents to be reviewed, I'm wondering if it would be helpful to extend the timeline to 2 weeks, to the end of August, to enable staff to do the work they need to do, which will be quite a lot. So I'd put forth an amendment for discussion. Excuse me, my wire fell out. To extend the deadline for producing said documents on August 31st.
Okay, so the amendment is now to modify the timeline to change the date to August 31st. So we go now into debate on that amendment. We have Mr. Paulus to speak.
Merci, Monsieur le Président. Actuellement,
Thank you, Mr. Chairman. At present, I think that the current date is acceptable. And if the government has a problem providing the documents within the deadline provided by the committee, it would be up to them to ask for an extension. This is urgent. The Canada-US border situation is urgent. there could be a second wave of COVID-19 in Canada, so I think we should move along faster. I know we're working remotely, but there are people with access to the information. There are people in the public service who can do the work even if they do it remotely. So I think that August 10th is a reasonable deadline if people get a move on.
Thank you, Mr. Paulus. Mr. Kellaway, I'm not sure, your hand is up again or still, and I'm not sure if I cut you off, so please carry on.
Oh, by all means, continue.
Thank you. We go now to Mr. Fisher. Mr. Fisher, go ahead.
Thank you, Mr. Chair, and I just want to get clarification from Mr. Kellaway's amendment. Is he saying on August 31st, or keeping the words the same as Mr. Paulus had moved, no later than August 31st?
I was thinking on, Mr. Fisher.
Okay, so if the subject matter was put all together prior to the 31st, you want it held until the 31st?
It's a good question. My original intent was to have them submitted on August 31st.
Thank you. Thank you for that clarity, Mr. Chair.
You're welcome.
Thank you, Mr. Fisher. We go now to Dr. Pawlowski. Dr. Pawlowski, please go ahead.
Well, now you got me confused. So I think the amended version is on, or can I clarify that to begin with? It's on. Is that what we're debating now?
Well, the debate is on the amendment as provided by Mr. Kellaway. Maybe I'll ask Mr. Kellaway to restate his amendment. Mr. Kellaway, you're muted.
My apologies there. So I'd be open to having the documents be provided no later than August 31st. So I'll clarify my original statement to say no later than August 31st, 2020.
All right. So so I guess that is the motion before us. Then is that the wording be changed to
no later,
no later than August 31st. Okay. Are we all? I think we require a unanimous consent to accept that. Do we have unanimous consent?
Monsieur le Président, j'ai des collègues, je crois.
Mr. Chairman, I think there are colleagues who would like to speak.
Mr. Chairman, there are some colleagues who'd like to speak unless I'm mistaken.
Yes, I'll get to those. I just want to make sure we're clear on the amendment. Mr. Kellaway has clarified the amendment that he was making. I wish to ensure that everybody is in agreement with the amendment, with the wording as it is now. Seeing nothing to the contrary, I shall take that as unanimous consent. We will go now to the speakers list. We have Dr. Pawlowski, you're still on the list. Do you wish to carry on?
I'm not sure if someone wanted to speak to the proposed amended, because I see a bunch of hands coming up, and whether Mr. Paulus in saying that people want to speak to the motion was speaking to the proposed amendment no later than, or to the original. So I'm not sure what we're debating, but assuming the debate is still on the date by which documents have to be submitted, I agree with the extension, and I go back to the same reasoning that these are people who have a lot of work to do to begin with, that this is a big issue, that there are so many border points between Canada and the United States, and not a lot of people working in this job, that they have sufficient number of things to do without making their lives so much more complicated by having to, instead of address those issues, divert that all, put it all back on the back burner because they have to produce documents, which I realize for the sake of transparency are important, but this means that you're prioritizing this function of producing documents over what I think ought to be their priority, which is dealing with the issues of border closure and who's allowed to go across the border and who isn't, which I think justifiably takes a good deal of their time.
Thank you, Doctor. We go now to Dr. Jaczek. Dr. Jaczek, please go ahead.
Thank you, Chair. And so just again to speak to Mr. Kellaway's amendment, it is not later than August 31st. So if possible, of course, we could get the documents sooner. So I think that's important to make sure we all understand that. I think our goal is actually to get the very best information we possibly can. We do know that many other committees are also looking at similar motions in terms of production of documents. And though, of course, this is important work to be done, I think we want quality, we want thoroughness in the name of truly understanding what the government's response has been, and obviously planning to look forward to the future. I'm sure we all would hope that we could open that border as soon as is feasible. But as Dr. Pawlowski has said previously, it is a very delicate issue, obviously in terms of the trade that is involved, that's so important to both our economies, but also, of course, to the health of the population, and not being so sure of what exactly is happening to the south of us at any one time from so many different states and so on. So I think what we're after is production that is transparent, that is full, and of good quality. And I think the timing as proposed in Mr. Kellaway's amendment makes a great deal of sense.
Thank you, Dr. Jaczek. We go now to Ms. Sadhu.
Thank you, Mr. Chair. Same thing. We also need good quality reports, and we should give a flexibility to staff. If the department finished before, that's great, but we should provide them the time that they need. So I agree with the amendment, the 31st August.
Thank you, Ms. Sadhu. I note I've been advised by the chair that the time for panel number 1 has expired. I will thank the witnesses for their testimony, their statements, and regrettably we are unable to question you further at this time, but thank you for joining us and I appreciate your time. But if you may leave the meeting if you wish. Thank you.
Thank you very much.
Thank you.
We go now to Mr. Fisher. Mr. Fisher, please go ahead.
I'm good now that I've got the clarity. As Dr. Jaczek said, and as MP Sadhu said, if these documents are put together in a pile before the 31st, I think that then it's prudent to get them out before the 31st. So no later than works for me. Thank you.
Thank you, Mr. Fisher. Ms. Jansen, please go ahead.
I have to say, I am completely shocked at the lack of urgency that the Liberals are showing here. I mean, unless they have information about, the fact that there won't be a second wave coming, I am absolutely appalled that we are suggesting that we have time. So I'm against the idea that we're just gonna, give ourselves a couple extra weeks. We don't have a couple extra weeks. That's what happened in the beginning of the pandemic as well.
Thank you, Ms. Jansen. Go now to Mr. Thériault. Monsieur Thériault, allez-y.
Mr. Thériault, go ahead. Well, Mr. Chair, when I said earlier that we need to be realistic in terms of our proposals, I considered that date to be a deadline, a drop-dead date. So the 10th of August, for me, given that we have a report to table, we're going to have to go through this information with a fine-tooth comb. We have a work plan. And to my mind, this date was a drop-dead date. It's the 15th of June. The government should be able to provide the documentation specified in the motion on time. It's crucial that this information be transmitted to us on time. I agree with Mr. Paulus. I agree with Ms. Jensen. To my mind, we have enough time, especially since this doesn't involve a whole slew of departments, unlike a number of other motions that we'll be looking at later that affect a number of departments. So there you have it. The information has to be processed. We have a report to be submitted. I'd like us to stick to the 10th of August.
Thank you, Mr. Theriault. We have now Mr. Van Bynen. Mr. Van Bynen, please go ahead.
Thank you, Mr. Chair. My concern is around getting clarity in terms of the information that's being covered. If we say anything up to August 31st or August 10th, for that matter, what happens for these are ongoing negotiations, and what happens if there's discussions that go on after that? And so shouldn't we be spending some time in defining the start date and the finish date as to where these documents are covered? Or do we intend for these documents to be available in the interest of full transparency? What happens if something comes forward or if there's a document that's eligible for review on August 31st? So should we define August 31st as the timeline for the review of the documents that we have in place, and then have a timeline for reporting? So I'm a bit confused in terms of the up to. I think if a defined date, if it said August 31st specifically, then we would know we're dealing with information from the time that the discussion started with COVID, and as to what time we're going, what the length of time is that we're going to be including the information. So it's not clear to me as to how much information that we're seeking because we don't have a start and a finish date. So I'd like some clarity on that from the person who proposed the motion.
Thank you, Mr. Van Bynen. I'd just like to clarify a point Mr. Theriault made, and I would ask the clerk to weigh in if she feels appropriate. I believe that the documents that we're requesting here they're not part of the study we're undertaking on COVID-19. The report that we will be getting out of that study will be derived from witnesses and from that have appeared before the committee, and from briefs submitted by those witnesses or by people to the committee specifically for this study. So the document matter is I believe a completely separate matter. And unless the clerk wishes to offer an opinion, I will go to our next speaker, which would be Mr. Davies.
Thank you. Well, I support the August 10th date. I really am flabbergasted that anybody would think it would take 2.5 months to produce this documentation. It's June 15th. We don't need to go to August 31st. And frankly, I think the documents could be produced much sooner than August 10th as well. So, we're in some ways it's arbitrary. We're just picking dates here. But if Mr. Kitchen's motion was that he wants documents by August 10th, then I think we should respect that. And whether it's August 1st or August 15th, none of us have any basis for determining if that's enough time or not. I think we should respect the intent of the original motion. And as Mr. Van Bynen said, obviously by picking a cutoff date, we are limiting what's going to come from after that. So if Mr. Kitchen must have recognized that in his motion. So there's no bureaucratic reason that we can't have these documents prepared in the next 2 months. So I'm gonna support the motion as August 10th. I also want to reiterate again that responsible government requires oversight by democratically elected politicians. And I'm getting concerned at this repeated sort of point or an argument made that there's by requesting disclosure for us to carry out our obligation to oversee the civil service or oversee the behavior and response of government, that somehow we are derogating or taking away from the government's ability to deal with the pandemic. The government can chew gum and walk at the same time. I haven't heard any member of this government say that transparency and accountability are not possible right now because they're too busy dealing with the pandemic. So I want to, in the strongest terms possible, indicate my opposition to this false dichotomy between taking away our civil servants' somehow ability to deal with the pandemic and discharge our responsibility to have parliamentary oversight. This is a minority government we're in right now. No party enjoys the majority support of the House of Commons. And I think it's unfair to suggest that by us as parliamentarians discharging our duties as this motion seeks to do for transparency and accountability, that somehow we are harming the government's ability to deal with the pandemic. There's not a shred of evidence of that, and it doesn't pass muster. So I'm going to support the motion as is, and suggest that we move on the vote. We've already lost one panel, and that's fine. By the way, you know, I want to also say that committee members have the right to move motions at committee, and it's unfortunate that sometimes it happens when we're in the middle of a study. But I'm also a bit troubled when people apologize to witnesses as if what we're doing here is somehow inappropriate. This is the only time we have to move motions, is during committee meetings, and it's a totally appropriate use of our committee time to do so. Unfortunately, it does take away from witness time, but since we have witnesses scheduled at every meeting, there's no other time for us to do this. So I respect my colleagues' right to move motions, and I respect the right to debate them. But I think we've heard a lot about this motion already, and I would hope that we can move to a motion to vote on as soon as we can.
Thank you, Mr. Davies. We go now to Mr. Fisher. Mr. Fisher, please go ahead.
Thank you, Mr. Chair. And I think Don made some very good comments there, and as did Mr. Theriault. If the 10th is arbitrary and the 31st is arbitrary, and my personal belief is that I want our public servants working on the matter in front of them, the pandemic. I want them, and I mean, Mr. Van Bynen talked about one day getting 91 emails. That's as an MP. You know, in our office, if you add up the emails that come in with our various accounts, it's several hundred a day. Imagine those public servants having to, maybe Don's right, maybe they don't have to stop their work. Maybe they can walk and chew gum at the same time. However, the important job here right now is taking care of Canadians during this pandemic and providing good advice. So yes, the 10th and the 31st could be very arbitrary, but and again, no later than in this amendment. So I would suggest that we consider supporting the 30th, then no later than the 31st, and we give these public servants the time they need to focus on their jobs, what they're tasked with doing every single day. So, you know, Don's right. We're probably at the end of the debate in this, and again, I want to thank him for his comments. This is the important stuff. This is the only time we get a chance to get together and hammer these things out. And we are in a minority, and we are finding ways. And this committee has done a very good job since we formed. We were the first committee that formed, and we've been able to get together and figure things out and make things work pretty well. You know, maybe there's a bump in the road every now and again, but I think what we've got on this committee is a group of MPs that really do want to get to the same place, maybe not exactly in the same way.
Thank you, Mr. Fisher. We go now to Mr. Theriault. Go ahead.
Yes, Mr. Chairman, I don't want to prolong this debate excessively, but with all due respect, it does seem to me that when we are going through a pandemic, a health crisis, the management of borders becomes absolutely fundamental. When the biggest focus of infection to the south, on Earth is just south of Canada, the border issue has been discussed at length by witnesses who appeared before you. So we cannot say that this will have no link to our relationship or to our report. So I am sure that the information we receive will help us reflect upon how the U.S. border should be managed within the context of the pandemic. With that, I'm very happy to go to the vote.
Thank you, Mr. Theriault. We go now to Ms. Jansen. Ms. Jansen, go ahead.
Yes, Mr. Fisher was talking about the importance of staff being able to focus on their jobs. And I just want to mention that we also need to focus on our job, which is the safety of Canadians. And that would be why we need to get this done as quickly as possible. Any delay can mean further problems with COVID-19 in our country during the second wave. We need to understand what happened, and that is our job. We're focusing on the safety of Canadians, and we do need the staff to help us by providing us with those documents.
Thank you, Ms. Jansen. Mr. Paul Hoos, go ahead, please.
Merci, Monsieur le Président.
Thank you, Mr. Chairman. I believe that you've heard the three opposition parties, and we are all agreed. So it's not unusual to see my Liberal colleagues want to extend the deadline. That is part of being in government, but I think we can finally vote on the amendment and vote on the motion.
Thank you, Mr. Paul Hoos. We go to Mr. Kellaway, please.
Mr. Palouse took the words right out of my mouth. I think we're at a point now where we should vote on the motion, and I thank my colleagues for a spirited debate. A lot of great points, and some that I will consider different from mine, but that's what democracy is about. So I would recommend that we put this to a vote.
Thank you, Mr. Kellaway. We go now to Ms. Sidhu.
Mr. Chair, as you know, it's a National Public Servant Week. I really want to recognize all staff. We are working very hard. They are also translator trying to keep up, mostly meet a deadline from all the numbers of motion passed at multiple committees. And I really want to say thank you. And we all recognize this National Public Service Week after all. And thank you, all my colleagues. We are also working very hard to government response to COVID-19. And I agree that if staff is working hard, we are working hard. And of course, we need a quality report. That is why as I said before, if we got before that, well and good, but I again support the same thing, we need staff need a time to make a report, and it is an important report. Then we can we can do readiness for if the second wave is there. Thank you, Mr. Chair.
Thank you, Ms. Sidhu. Seeing no further interventions, we can go for a vote. I will ask the clerk to conduct a vote, and the vote is on the amendment of changing the date. Please go ahead.
Thank you, Mr. Chair. If you are in favor, please say yay. If you are opposed, please say nay. Mr. Fisher.
Yay.
Thank you, Mr. Kellaway.
Yay.
Thank you, Mr. Pulowski.
Yes.
Thank you. Ms. Sidhu.
Yay.
Mr. Van Bynen.
Yay.
Ms. Jansen.
Nay.
Mr. Genereux.
No.
Thank you. Monsieur Paulus.
No.
Mr. Weber.
No.
Monsieur Theriault.
No.
Mr. Davies.
No.
Mr. Chair, the results are 5 in favor and 6 against.
Thank you. So the amendment is defeated. So we are back to the original motion as previously amended. So we carry on the debate on that, and we have Mr. Van Bynen. Go ahead, Mr. Van Bynen.
Thank you, Mr. Chair. This is more a bit of a housekeeping amendment that I'm proposing. And we didn't insert the word "and" when we deleted the emails. So I'd suggest that we clean that up.
Madam Chair, sorry, Madam Clerk, is that an amendment that we can just be part of the general housekeeping about the motion, or do we need to actually debate that particular change?
Mr. Chair, if the committee sees fit to allow me to clean up the grammar, then I would be certainly willing to do that.
Do we have an agreement so far to do that? Okay, very well. We now have Mr. Fisher. Please go ahead.
Thank you very much, Mr. Chair, and I would like to propose the following amendment. I would like to add in after August 10th, 2020, the words, provided that the department does its assessment and vetting in gathering and releasing the documents as it would be done through the access to information process. Now, Mr. Speaker, this amendment has been added to several of the other committees when they've done motions just like this. See here, John Barlow moved in, I guess it was in the Agri on Friday, June 5th, that John Barlow moved that given the Department of Agriculture on Agri-Foods written response to MP Philip Lawrence's questions on the cost of carbon tax to the agriculture industry, in which their analysis and estimates do not reflect the federal backstop, the committee send for a copy of all reports, briefing notes, memorandums, and emails and documents related to the federal carbon tax and its cost, directly or indirectly to the agricultural industry, broken down by province, to be provided in both official languages by Saturday, August 1st, 2020. And then he added, Mr. Barlow added, provided that the department does its assessment and vetting in gathering and releasing the documents as it would be done through the access to information process. This was done also in several other motions. I'm not sure if you want me to read them all into the record, but Mr. Barlow moved them in 2 or 3 different motions. Kelly Block moved that in context of its study of the government's response to the COVID-19 pandemic and pursuant to Standing Order 1081A, the committee send for the following documents to be provided by the government by Monday, August 3rd, 2020, and that the documents be published publicly on the committee's website by Monday, August 10th, 2020. There's that date again. And that departments tasked with gathering and releasing the following documents do their reassessment and vetting as would be done through the access to information process. So I've got several more here, Mr. Speaker. It seems like that is the way most of the motions have gone, both in English and French, from Madam Block and Mr. Barlow as well. So I would suggest that we tag that on to the end of this this motion as well. So move. Thank you, Mr. Chair.
Thank you, Mr. Fisher. And though I don't actually aspire to be speaker, so Mr. Chair is quite sufficient. We go now to Mr. General. Please go ahead.
Thank you, Mr. Chair. And anytime Mr. Fisher wants to read more conservative motions into the public record, I certainly welcome him to. However, yes, certainly that seems like a fair amendment, and we'll be supporting it.
Thank you, Mr. General. Dr. Pawlowski, please go ahead.
I think given the fact that the Conservatives seem willing to accept the amendment, I don't know if I have anything further to say.
Thank you, Dr. Pawlowski. Dr. Jaczek, please go ahead.
Well, I essentially would also agree. It seems to me that this addition through this amendment is clearly done to ensure that privacy is protected, and I think that we can all understand the sensitivity potentially, and so I think this is a very good amendment. Thank you.
Ms. Sadu, I see your hand up. Please go ahead.
Thank you, Chair. I think it's a reasonable request that will help narrow the scope to relevant information, which will be beneficial to our committee. I support my colleague.
Thank you, Ms. Sadu. Mr. Thériault, please go ahead.
Mr. Chairman, I have some difficulty with the way I understand this amendment and how it protects privacy. How would a memo be associated with privacy? How can background documents submitted to a minister be linked to privacy? How can memos be linked to privacy? I understand that with emails, we might have had privacy issues and the documents would have needed to be reviewed. But I fear, and perhaps those who have more experience than I do with the committee work might answer that, and I'm open to hearing it. But a little earlier, Mr. Davies was talking about documents that were too severely redacted. So are we not yet again opening the door to documents that would be, again, too heavily redacted, since there are no longer emails included in the motion? It may happen that people will put comments in an email that they wouldn't put into a backgrounder, and that sometimes the comments in the email go beyond what we might be seeking. But I am having difficulty understanding how these official documents might in any way compromise anyone's privacy. I am asking a question, and if someone can reassure me or answer the question, I'd be grateful.
Mr. Paulus, your hand is up. Please go ahead.
Thank you, Mr. Chairman. I think we've been discussing this motion long enough. I understand Mr. Theriault, and we can talk about this later. We don't want redacted documents. We want as much information as possible. We're ready to accept Mr. Fisher's amendment, and I would like us to move to the vote.
Mr. Fisher, you're up.
Thank you, Mr. Chair, not to be confused with Mr. Speaker, and I thank Mr. Paulus on that. But just basically, any agreements that we have between the Canadian border and the United States border are bilateral, and they require an ongoing agreement with the United States. Decisions have to be made with that in mind. If we apply the ATIP rules, that would ensure that any sensitive materials pertaining to Canada-U.S. borders are not released to the public. So I would suggest that this is a good time, Mr. Chair, to vote.
Thank you, Mr. Fisher. And seeing no further interventions, I will ask the clerk to conduct the vote, please. This is a vote on the motion itself as previously amended.
Thank you, Mr. Chair. Just for my understanding, this is a vote on the amendment of Mr. Fisher.
Sorry, you are correct. Go ahead.
Thank you, Mr. Chair. Those in favor of the amendment of Mr. Fisher, please say yay if you're in favor, nay if you're against. Mr. Fisher.
Yay.
Mr. Kellaway.
Yay.
Mr. Pulowski.
Yes.
Ms. Sidhu.
Yay.
Mr. Van Bynen.
Yay.
Ms. Jansen.
Yay.
Mr. Genereux.
Yes.
Monsieur Paulus.
Wait.
Yay.
Yes.
Monsieur Theriault.
No.
Nay.
Mr. Davies.
No.
Mr. Chair, the results are 9 in favor, 2 against.
Thank you, Madam Clerk. So the motion or the amendment has passed. So we're now back to the original motion as twice amended. Is there any further debate on this motion? Seeing no interventions, we will ask the clerk to conduct a vote on the motion as twice amended.
Thank you, Mr. Chair. I will go right to it. Yay in favor, nay against. Mr. Fisher.
Yay.
Mr. Kellaway.
Yay.
Mr. Pulowski,
Yes.
Ms. Sidhu,
Yay.
Mr. Van Bynen. Mr. Van Bynen, I'm sorry, I
Yes.
did not hear you. Thank you.
Yes.
Ms. Jansen.
Yes.
Thank you. Mr. Genereux.
Yes.
Monsieur Paulus,
Oui.
Yay.
Mr. Weber,
Yes.
Monsieur Thériault,
Non.
Nay.
Mr. Davies.
Yes.
Mr. Chair, the results for the motion as amended are 10 in favor, 1 against.
Thank you, Madam Clerk. The motion as twice amended is now passed. Do we have time now to start our second panel?
Monsieur le Président.
Mr. Chairman, if I may, says Mr. Paulus.
Merci, monsieur.
Thank you, Mr. Chairman. Now, there were two motions. What of the second motion? It should be voted on immediately because it was already moved.
Thank you. I forgot that.
Just a point of order, Mr. Chair. The other motion wasn't moved. It was read, but it wasn't moved.
Monsieur le Président.
Mr. Chair, if I may, Mr. Paulus speaking.
Actually, move the motion as you read it, please.
No.
Perfect, Mr. Chair. Let me read it out loud for you. That Public Safety Canada provide the committee with the total number of RCMP, CBSA and Correctional Service officers infected with COVID-19 broken down by cohort and province between March 11 and June 15, 2020, and that these statistics be presented to the committee no later than July 10, 2020. And on that, Mr. Chair, before ceding the floor, I want to specify that we're talking about the officers for the 3 agencies. This data isn't difficult to put our finger on. This information should already be available to the government. Thank you.
Thank you, Mr. Paulus. Is there any debate? We have Mr. Fisher. Please go ahead, Mr. Fisher.
Mr. Chair, I think this notice motion by Mr. Kitchen is a pretty good motion. I'm inclined to support this. Thank you, Mr. Chair.
Thank you. Any further intervention? Seeing none, I will ask the clerk to conduct the vote.
Thank you, Mr. Chair. All those in favor say yay. All those opposed say nay. Mr. Fisher.
Yay.
Mr. Kellaway.
Yay.
Mr. Pulowski.
Yes.
Ms. Sidhu.
Yay.
Mr. Van Bynen.
Yes.
Ms. Jansen.
Yay.
Mr. Genereux.
Yes.
Monsieur Paulus.
Oui.
Yay.
Monsieur Thériault.
Yay.
Davies.
Yes.
Mr. Chair, there are 11 yeas and 0 nays.
Thank you, Madam Clerk. The motion is passed as moved. Thank you. Okay, so I understand we have a hard cap at, is it 3 p.m. Eastern or 4 p.m. Eastern? 3 p.m. Eastern. So we have less than an hour to go. I guess we can start the second panel and do what we can in that hour or in that less than hour. And that being said, I will suspend the meeting right now while we bring in the next panel. Thank you.
Mr. Speaker, while you're suspended, may I speak just with the clerk for a moment?
Oh, yeah. Thank you, Madam Clerk. We will get straight away into this. We have a hard cap at the top of the hour, so it's likely we'll get statements and maybe an abbreviated first round. So having said that, I will introduce, we have our panel of witnesses. We have from Native Counseling Services of Alberta, we have Ms. Marlene Orr. From the John Howard Society of Canada, we have Ms. Catherine Latimer. From the Union of Safety and Justice Employers, we have Mr. Stanley Stapleton, Mr. David Neufeld, and I guess that's it. Thank you all for coming. We were delayed with committee business, but we'll try and give everything our full attention. So please go ahead, Native Counseling Services of Alberta. You have time for, well, there's a 10-minute statement. If you can abbreviate that at all, that would be appreciated. Thank you.
Good afternoon, Mr. Chairperson and members of Parliament. I'm honored to speak to you today. My name is Marlene Orr. I'm speaking to you from Treaty 6 territory, the traditional lands of the Cree, Nakota Sioux, Métis, and many other Indigenous peoples. As a member of the Beaver Lake Cree Nation in Treaty 6, I'm especially proud to acknowledge the traditional territory of my people. I'm the Director of Corrections for Native Counseling Services of Alberta.
Monsieur le Président, point d'ordre.
Yes,
le son est très mauvais. Je m'excuse pour le témoin. Est-ce qu'on peut réparer ça?
Yes. Can a French translation be, is that something we can take a quick look at? We're good? Can we, I'm sorry, could the witness please try again, please?
I am the Director of Corrections for Native Counseling Services of Alberta, a not-for-profit that has provided and continues to provide programs and services for Indigenous people in conflict with the law for over 50 years. Native Counseling Services of Alberta runs the largest healing lodge for male federal offenders in Canada and the first Section 81 healing lodge for federal female offenders. Healing lodges are minimum security federal institutions in which the care and custody of minimum security federal offenders is transferred to the Indigenous community under the Corrections and Conditional Release Act. Focusing on Indigenous culture and ceremony, Section 81 healing lodges work to reintegrate Indigenous federal offenders into the community using an Indigenous worldview. We are better equipped to deal with Indigenous offenders than correctional services because we understand historic trauma, take our guide at reintegration because we know our communities. Section 81 healing lodges are the face of reconciliation and Indigenous reintegration for federal offenders. Today, I'll speak about the impacts of COVID-19 on service providers in particular. The wider impact is important to understanding the impact on offenders. Since the Truth and
Madam Orr, your sound is gone. I'm not sure if it's on your end or my end, but Madam Orr, are you there? Maybe we could get Madam Clerk. Maybe we get someone to give her a call, and we will carry on with another witness group. Let us go now to the John Howard Society. Please go ahead, Ms. Latimer. And you're muted.
Okay, am I unmuted?
Yes, go ahead.
Great. The John Howard Society of Canada is a charity committed to just, effective, and humane criminal justice systems. And I'm grateful for the committee's invitation to share our concerns about the response to the outbreak of coronavirus in Canada. For many Canadians, the pandemic has caused fear and significant disruption to our lives. For others, it has had tragic consequences, and we send our condolences to all those who have lost friends and family to this disease. The federal government has direct responsibility for prisoners in their care, and the impact of the coronavirus on the federal prisons has been profound. 2 people have died, more than 360 people have been sickened, 5 institutions have been contaminated, the rate of infection was assessed at 13 times the rate in the general population. According to the Correctional Investigators' April 23rd release, 400 prisoners were held in medical isolation in extreme conditions that violated their rights. Hundreds more are locked down in their cells for 22 hours a day with inadequate, meaningful human contact. And this is inconsistent with the UN definition of solitary confinement and its prohibition. Prisoners protesting the conditions were met with force. In some cases, that force resulted in the prisoners having to seek medical assistance outside of the prison. The visits with family and volunteers were canceled, chaplaincy services were suspended, all of which increased feelings of isolation, and programs and opportunities to make progress on correctional plans were suspended, leading to increased feelings of hopelessness and frustration. We are experiencing the worst crisis in Canadian corrections since the Kingston Pen riots almost 50 years ago. The tragedy was that we were forewarned by epidemiologists and other medical experts about the amplifying effect prisons have on the virus. The medical and human rights advice was to remove as many people from prisons as possible and give the remainder a chance for prevention and permitting of social distancing. As soon as the pandemic was labeled as such in mid-March, there were calls on the federal government to safely release prisoners. These were ignored. The first 2 prisoners at Port Cartier tested positive on March 30th. And on the 31st, Minister Blair asked CSC and the Parole Board Canada to consider ways to expedite releases. Other more expeditious measures, like respites under the Governor General's clemency authority, were not considered. While other jurisdictions and provinces released hundreds and thousands of prisoners following the advice of medical experts, Canada did not. Canada has duties to prisoners. Section 215 of the Criminal Code provides that those detaining individuals have a legal duty to provide the necessaries of life to those under their charge and could be criminally liable if, without lawful excuse, they fail to discharge that duty and it endangers the life of the prisoner or endangers his or her health in a permanent manner. The Corrections and Conditional Release Act obligates the service to provide essential health care and reasonable access to non-essential health care, which conform to professionally accepted standards. A core purpose of the correctional system, as set out in the CCRA, is to carry out sentences in a safe and humane manner. And CSC is required to use the least restrictive measure consistent with the protection of society's staff members and offenders. The World Health Organization and other international bodies released a joint statement about how COVID-19 should be managed in prisons. Among other things, it stated that COVID-19 responses in prison must respect the human rights of people deprived of their liberty, and the disruptive impact of restrictions should be actively mitigated. It provided that any intervention should comply with the UN standards for the treatment of prisoners, the Nelson Mandela rules. Those rules define solitary confinement as 22 hours or more in cells without meaningful human contact and prohibit prolonged solitary confinement, which is such confinement of 15 days or more. Which is understood as a form of cruel treatment. And the Canadian courts have recently recognized the harm that such isolated confinement can cause and found charter violations. Hundreds of prisoners have experienced isolated confinement for well over 15 consecutive days as a response to the COVID-19 virus. Many would like to see an in-depth, independent inquiry into the government's handling of the COVID-19 crisis in our federal prisons to assess whether obligations were met, how people died and became ill, both from the virus and from the strict isolation imposed in response to it, and to assess what should be done in future for a second wave or another pandemic. Based on concerns I have heard from prisoners and their families, the inquiry could provide much needed answers to the following. And in the interest of time, I'll just give you categories rather than go into the issues that have been raised by prisoners and their families. Those include issues associated with the prevention of the disease from getting into the prison, dealing with the infected prisoners once the prisons were contaminated, dealing with the other prisoners, and reopening the prisons and bringing back some of the strict measures that have been put aside during the pandemic. In conclusion, individuals in our federal prisons have suffered as a result of the government's response to coronavirus. It is questionable whether the duties and obligations to prisoners have been met during this period, and I hope this committee will recommend that an in-depth and independent inquiry be held to examine and learn from this crisis, during which the physical and mental health of our prisoners were imperiled and their rights disregarded. Thank you so much.
Thank you, Ms. Latimer. We go now to the Union of Safety and Justice Employees. You have 10 minutes, but if you can do it faster, that would be great. Thank you.
Good afternoon. My name is Stan Stapleton, and I am the National President of the Union of Safety and Justice Employees, also known as USJE. As a national organization representing employees working on the front lines of the pandemic, I am immensely appreciative to have the opportunity to be here with my colleague, David Neufeld, who is the National Vice President. USJE represents over 16,000 federal public service employees who work for 18 federal departments and agencies in a safety or justice capacity. However, the largest number work for the Correctional Service of Canada. Unlike the Union of Canadian Correctional Officers, UCO, who play a security function at federal penitentiaries, USJE represents a diverse range of employees with crucial rehabilitative and administrative functions, including for food service officers, parole and program officers, teachers, managers of assessment and intervention, facilities and maintenance crew, and licensed practical nurses. Hundreds of federal parole officers and case management teams from coast to coast oversee the reintegration of federal offenders. Their job is to ensure that federal offenders across the country adhere to their supervision plans and are not at risk of reoffending. I will be very honest with you. When COVID-19 hit, I do not believe we were prepared. Whatever pandemic protocols may have been in place were not immediately applied within CSC. On March 18th, I wrote a letter to the Commissioner Ann Kelly appealing to her to immediately implement proactive measures to minimize the spread of COVID in federal prisons and to contain the footprint in the community. We needed CSC to do what was effectively being done in Canada's long-term homes. Heavily control who was coming in and out of federal penitentiaries, significantly increase cleaning and sanitization protocols, ensure appropriate use of PPE, and encourage face coverings and begin widespread testing. Also stop employees from working at multiple sites and isolate presumptive cases, employees, or offenders. For several weeks, we found that new protocols were not always applied consistently. For example, limited access to testing and PPE, sanitization was inadequate, employees were moving between sites, food delivery within affected prisons was presently presenting opportunities for further infection. There were not enough laptops to enable work from home. Quite frankly, when considering the living and working conditions at CSC during this pandemic, it is remarkable that major outbreaks were contained to 5 federal sites and 2 deaths. Although extremely unfortunate, it could have been much worse. USJE's senior leaders worked around the clock for several weeks to highlight challenges, gaps, oversights, and opportunities to do things better when it came to COVID. One could say that we were relatively lucky this time. However, many CSC employees working at full capacity and under an enormous stress during the past few months would not view the situation so favorably. Thankfully, at this stage, CSC and its union partners are in a much better place. This is in part because of the creation of a joint transition task force established by CSC, USJE, and other labor partners. The task force is something USJE called for in order to keep employees and offenders safe. The work of this task force has been very encouraging in terms of the level of respect and engagement. We commend Bev Arsenault's leadership with this task force. I believe it could represent a new direction in how CSC treats its labor partners who have firsthand knowledge of the challenges on the ground. I will now turn it over to my colleague, David Neufeld.
As we begin to enter a reset phase of this pandemic, it is imperative that USJE work very closely with CSC and other stakeholders to, firstly, critically evaluate the effectiveness of the protocols put in place because of COVID-19 and determine what could be done better and how. Secondly, assess what is needed in this new normal environment for operations to continue efficiently and safely, while also beginning to prepare immediately for future waves and challenges. To do so, we have identified the following recommendations. 1, USJE is encouraged to see greater collaboration between our organization and CSC. This meaningful joint work is already yielding positive outcomes for employees, offenders, institutions, and facilities as a whole. USJE is committed to working closely with all stakeholders to ensure we take the time to critically reflect on the past few months, as well as act now to mitigate the impacts of the potential future pandemic. We believe the work of the task force must continue for a minimum of 1 year until we are safely behind this pandemic. 2, from the onset, safety measures must meaningfully take into account input from frontline employees who work within the institutions, community correction centers, and community parole offices. In the early days, USJE members across the country have reported immense frustration in having their feedback disregarded by CSC management. Many felt the lives of offenders and employees were on the line, especially in outbreak sites where hundreds of offenders became ill. Our members are often the people who will be putting the new protocols into place, so their buy-in is absolutely paramount. No one understands operation considerations better than those who see their impacts daily. Their input matters a great deal and needs to be treated with respect. Thirdly, for service levels to continue at their pre-pandemic standards, more resources, especially human resources, will be required. Many CSC employees have adapted their work to be in line with social distancing and other COVID-19 requirements. For example, a CSC program officer in the community who is in charge of delivering a weekly rehabilitation program to a group of 10 offenders now has to meet individually with each one every week through video or teleconference. Not only will this have require far more time to accomplish, it means each offender must have access to a smartphone or device, reliable internet connection, and a quiet place to speak with the instructor. Sufficient human resources are imperative to maintaining the required frequency of contact with offenders. Meaningful frequency of contact is absolutely critical to ensuring proper supervision and rehabilitation, as well as public safety. For some, COVID-19 has only worsened workload issues and stress levels given the realities of working differently. Fourthly, sanitation processes must be improved. COVID-19 has forced us to take a much closer look at cleaning protocols within CSC. CSC has just recently committed to the Public Health Agency of Canada standard. Over the past few months, employees have worked hard to contribute to enhanced cleaning efforts, even if it was not part of their official duties. However, the current practice of relying on a small number of offenders to do the majority of sanitization in very large penitentiaries with little or no training in pandemic standards is irresponsible. Contracting these critical tasks to outside agencies with highly transient employees is also not the answer. Using outside cleaning contractors who enter a number of sites increases the chances of spreading the virus between institutions. We witnessed this during the outbreak of Mission Institution in BC, where cleaners were going between 2 different penitentiaries during the same week. Additionally, interview rooms for multiple staff to meet offenders in federal prisons are often extremely small and not cleaned regularly. CSC penitentiaries and CCCs carry the same risk as Canada's long-term care homes. We urge CSC to hire full-time, properly trained cleaning professionals in each institution, community parole office, and community correctional center. Lastly, in terms of the community footprint, community parole officers and case management teams have significantly decreased their footprint and reduced community contagion through delivery of programs by telephone or video. They are also providing supervision by reducing the number of times an offender travels to a community parole office or by meeting with the offender in the community at a safe distance. Case management teams in many instances can effectively work from home. In light of the prospect of a second wave, USJE strongly recommends no meaningful change to this modified approach to overseeing offenders in the community until Canada is confident that we are past a second wave. In closing, we urge committee members to consider how the federal government can assist the federal correctional system with proper resources to maintain this new normal. Additional human resources, a contained footprint, and more robust cleaning practices are imperative to keeping offenders, employees, and Canadians safe. The federal government must also ensure that public health agencies throughout Canada offer widespread testing to offenders and employees. CSE must continue to foster ongoing collaboration with its labor partners and frontline employees. Thank you for your time. We are pleased to answer any of your questions.
Thank you. I see we have Ms. Orr has rejoined us again. I understand she had a power surge in her building, and that sounds very bad. Please go ahead. We'll make do as best we can. If you'd like to start your presentation over, you have 10 minutes. And please speak slowly and carefully. Thank you. And you are on mute.
Good afternoon, Mr. Chairperson, members of Parliament. I'm honored to speak to you today. My name is Marlene Orr, and I'm speaking to you from Treaty 6 territory. As a member of the Beaver Lake Cree Nation in Treaty 6, I'm especially proud to acknowledge the traditional territory of my people. I'm the Director of Corrections for Native Counselling Services of Alberta, a not-for-profit that has provided and continues to provide programs and services for Indigenous people in conflict with the law for over 50 years. Native Counselling Services of Alberta runs the largest healing lodge for male federal offenders in Canada and the first Section 81 healing lodge for female federal offenders. Healing lodges are minimum security federal institutions in which the care and custody of minimum security Indigenous federal offenders is transferred to the Indigenous community under the Corrections and Conditional Release Act. Focusing on Indigenous culture and ceremonies, Section 81 healing lodges work to reintegrate Indigenous federal offenders into the community using an Indigenous worldview. Our healing lodges are better equipped to deal with Indigenous offenders than Correctional Services of Canada or their other partners, because we understand historic trauma. We take our guidance from our elders on how we address those issues of trauma and the relationship those issues have to criminal activity. We're better at reintegration of Indigenous federal offenders than Correctional Services Canada. Section 81 healing lodges are the face of reconciliation and Indigenous reintegration for federal corrections. Today, I'll speak about the impact of COVID-19 on Indigenous people in general and on Indigenous offenders and service providers in particular. It's important to understand the wider impact so that we can understand the impact on offenders. Since the Truth and Reconciliation Commission hearings and calls to action, we've become better informed regarding the social issues seen in the Indigenous community and the direct link those issues have to historic trauma. We understand the myriad of impacts like loss of culture, fragmented families, lack of parenting models, addiction, poverty, and violence in all forms are directly tied to legislation in Canada that sought to strip Indigenous people of their very cultural and legal identity in order to have access to their land. The onset of COVID-19 left us all unprepared for upheaval in day-to-day life. Rapidly changing government and corporate policies left us in fear, anxiety, and isolation for months. The impact was widely felt amongst Canadians, but particularly Indigenous people and communities who still struggle with poverty and other historic trauma impacts. With the measures put in place by Canada, the provinces, municipalities, and First Nations communities, Mental health concerns and loneliness have added increased stress. The impact on our communities, where the intergenerational effects continue, has exacerbated existing mental health concerns for Indigenous people, perhaps to a greater degree than others. Unresolved issues of trauma have surfaced and have been magnified. Lack of access to the cultural and spiritual community have left many Indigenous people unable to cope with their emotional and mental health challenges without support. That is especially true for Indigenous offenders in the institutions. As restrictions ease, the use of masks, gloves has been stressed by provincial and federal authorities. With many provinces moving into relaunch, the use of masks will become increasingly necessary for people to access services. For example, in Alberta, persons attending court are required to wear masks, yet no masks are supplied by government agencies. Given the level of poverty many Indigenous people experience, they're not likely to have the resources to purchase this protective equipment. Many Indigenous not-for-profits are expected to bear the cost of providing this. Very early on in the pandemic, schools closed down, and the expectation was that classrooms would move online. Students were expected to continue their studies while isolating. While laudable, these efforts come from a very privileged perspective. According to the Canadian Poverty Institute, Indigenous peoples in Canada experience the highest levels of poverty. A shocking 1 in 4 Indigenous people are living in poverty. Speaking from lived experience, I can assure you that luxuries like electronic devices and Wi-Fi or phone data are not financially attainable for those in poverty. This need for devices and data to stay connected became an issue for us as well. Online supports necessary for marginalized people excluded Indigenous people because of the access to connectivity. And we've seen here today, those are issues that our organization faces, providing services out of a federal building. Funders force many organizations to bear the real cost of setting up online services. And when you consider many Indigenous people are too poor to stay connected virtually, it doesn't really make sense. Many Indigenous communities have connectivity issues because of the lack of quality internet within their communities. One example is a Métis settlement in Alberta whose Wi-Fi services do not extend beyond the governance office because of lack of internet infrastructure in their remote communities. This lack of connectivity was felt by us. At the very start of the pandemic, corrections staff were ordered to work from home using Correctional Service Canada laptops to remain connected to the offender management system. Staff were kept safe and supported by corrections supplying them with the equipment necessary to do their jobs in isolation. Indigenous community partners in corrections didn't have the same access. And as a result, we couldn't work from home. Healing Lodge staff had to go to work daily and risk exposing themselves and offenders in a residential facility. Despite numerous requests for laptops and connectivity, the 2 Healing Lodges I oversee were not provided them. We were told by CSC there was no equipment available, yet we received reports that approximately 20,000 laptops were purchased during the pandemic by CSC and are sitting stockpiled in Ottawa. The unspoken messaging is that the government is concerned about the safety of their staff, but not concerned about the safety of Indigenous partners. While corrections staff were working at home, some of their responsibilities were deemed too unsafe for them to undertake. For example, urinalysis testing performed on inmates and conditionally released offenders. This responsibility was devolved to my staff because apparently the task is not unsafe for Indigenous people. One of our healing lodges is in this old federal building. CSC is responsible for the maintenance. We had an electrical fire that burned out our entire camera security system. Correctional maintenance staff refused to enter our building, even though we implemented precautions long before CSC did. We were left to deal with that on our own. CSC was slow to implement a COVID-19 response. We couldn't get answers to questions we had about policy, practice, testing. As our healing lodges are also part community residential facilities, we have both inmates and conditionally released offenders. We were the only Alberta-based community residential facility that remained open during the pandemic. We implemented policies around COVID-19 weeks before CSC did, and we continued to accept offenders released from the federal institutions. Our policies included a requirement for institutional health care to attest offenders being released were COVID-free or at least symptom-free. For 3 solid weeks, institutional and community parole staff were dismissive of our policy and fought us on every transfer case. We asked that they attest that the transfer of released offenders occur in a CSC vehicle, sanitized after the previous use. Every federal institution we received released offenders from fought my staff for 3 weeks about this. This spoke to the lack of pandemic policies and practices within CSC. It also spoke to the lack of health and safety practices in general. The pandemic exposed cracks in the relationship between CSC, the Indigenous community, and community partners. With tremendous political pressure mounting, CSC and the parole board rushed to depopulate the prisons for fear of COVID-19 spreading. In this rush, there was little understanding of the reality of how this would affect Indigenous people and communities. The rush to depopulate was a rush towards displacement, increased risk of offender exposure to the virus, and poverty. Well documented that my people are predisposed to a number of health issues like diabetes, tuberculosis, respiratory issues. Because of this, Indigenous people in our communities are particularly vulnerable to COVID-19 and the risk of contracting the virus much greater in the presence of these health concerns. This led to First Nations taking unprecedented steps to safeguard their communities by locking down their borders and restricting access to those who did not live in the community. The increased cost of implementing security and ensuring food sovereignty has been enormous and challenge for our communities. If you don't live in the community when the pandemic hit, you were not likely allowed to go there. CSC did not have the relationship with Indigenous communities to fully understand the impact of releasing Indigenous offenders to closed communities.
Ms. Orr, we're out of town. I wonder if you could, we're out of time. Could you please wrap it up, please?
Sure. What we are recommending is that a number of things take place. Ensure Indigenous communities have good quality internet access. Ensure a stockpile of PPE for not-for-profit. Ensure work-at-home policies for government workers apply to contractors as well. Ensure a thorough review of the fast tracking of Indigenous offender releases to ensure a return to the systemic barriers faced by people in corrections happen again. Ensure Indigenous offenders remain connected to their families and cultural support, keeping in mind community issues of connectivity. Ensure solid health and safety practices and corrections that are sustainable during normal and or non-pandemic times. Thank you for hearing me out today, and I am open to any questions you may have.
Thank you, and thank you to all the witnesses. Unfortunately, we are completely out of time. We have a hard cap on these video conferencing facilities as at 3 p.m. Eastern time. I would certainly encourage all the witnesses to submit additional material in a written brief to the through the clerk. We would certainly appreciate hearing more from you. And I regret that we're unable to ask questions at this point. Thank you for your time. And thank you for your patience. And thanks to all the members. And with that, we are adjourned.